Good afternoon, and thank you so much for the introduction, and thank you for the invitation to be here today. I'm Marius Geantă. I'm representing the Center for Innovation in Medicine. I actually, 9 years ago, founded this organization, who is a civil society, not-for-profit organization. This sounds like is nothing important, but I think I will convince you that we did a lot of things in the last 9 years when it comes to innovation implementation in the healthcare sector, with a very strong focus on personalized medicine and cancer. But first of all, I'm very happy to be here today. It's for the first time for me in Croatia, but I have, I think, some memories back in the 80s. I am a big fan of football. I used to watch football games when I was studying, of course, in the childhood. But in Romania, it wasn't so easy because the football matches wasn't on TV, right? So the solution, actually, my father and our friends identified was this one in the picture, actually to go with our car to a high hill and try to reach the televisions from former Yugoslavia and from Bulgaria, who streamed the football games. I remember very well the European Championship in '88. And it wasn't an easy task, because you have to, first of all, to have a high hill around your town. Then you have to have a car with a battery and a mobile TV. And you can see that little piece on white is a small portable TV that was connected to the battery of the car. So and you can imagine that the image was in black and white, sometimes stopped, sometimes, wasn't so clear, and very, very important, the people who explained the football game, speak a language that we were not able to understand. So, I always, have this in mind when I was thinking not only, that following the passion means, to actually to skip so many hurdles, but this was actually the reality in the 80s overall, in society, even in the healthcare. So it was a white and black image with a lot of noise around and very few details. And now we are, and you can see top down in the right, you can see this 8K image. So we are living now in a high definition environment. There is a pleasure, but there is not enough time to watch all the football matches in the world. And this can be translated very, very easily, I think, also in the healthcare sector, where the new technologies and data actually lead us to a new era, the era of precision or personalized medicine. When I was a student in the medical school in Bucharest in the 6th year of studying at the medical university, I have been appointed by the main sport journal in Romania as special reporter. So I used to work in communication 20 years ago. And for me, it was like a school, because I learned a lot about branding, and we have seen earlier today a very good presentation on the power of the brands in the healthcare sector, especially in this post-pandemic field. I learned a lot about journalism, about communication. So when I graduated medical school, I became what now is called an entrepreneur. And I launched this journal, a scientific journal called Hippocrate. And back in February 2012, we actually put on the cover of our journal this topic of virtual patient. And the question was, if we can anticipate what the weather will be like tomorrow, why cannot we have a prediction about how we will react to a treatment? And I think this is the key question behind personalized medicine and the concept of digital twin. you might heard about the digital twin, is this idea of collecting all the data that are relevant for our health, to integrate them, to put them in an analytic form, and being able to test on a digital twin, on our digital twin, any intervention from prevention to treatment before that intervention to be proposed to ourselves. And this is actually the difference between the black and white TV back in the 80s and the traditional way of looking to the medicine and the medicine of the future, because digital twin is still for the future, and part of the personalized medicine. It's not so distant the future, because we have been part of this project, IT Future of Cancer, that ended in 2020 before the pandemic, and the aim was to build a digital twin of triple-negative breast cancer. So the things are moving, and it's not easy to keep the pace with the innovation. So for that, of course, you should always look for innovation, for inspiration, and of course, this quote coming from Wayne Gretzky: "I skate to where the puck is going to be, not where it has been." This is of a very high value for us, for me personally, and it's the key code for the Center for Innovation in Medicine. So, we believed 9 years ago that the puck will be in the field of innovation, in the field of personalized medicine, in the field of prevention, and 4P medicine: personalized, preventive, predictive, and participatory medicine. And we build a lot of projects, from communication to education to policy, and I will refer to this, and also to the research, in an area of innovation that is not so easy, at least we might think at the beginning, because are very few innovators, around 2%, very few early adopters, and we should fight a lot to convince people to adhere to the innovation. And was the case with the vaccines during the pandemic, and we know how tough, and I'll refer a bit later, how tough actually was to convince people to vaccinate with mRNA vaccines that represent, I think, a high level, one of the highest level in terms of biopharma innovation currently. But for this, our approach is on this triplet innovation wheel. First is to identify and follow what is relevant in science and innovation, then to early engage with the policy and regulatators, and then once you set the policy frame and regulatory frame, to go to the implementation and real life experience. And my presentation today actually will follow this triplet of intervention. I mentioned that we believe that the puck will be in the field of precision medicine, of personalized medicine. In 2015, the EU Council, and I have been part of the consultation at that time, defined the personalized medicine as a medical model using characterization of individuals' phenotypes and genotypes, such as molecular profiling, medical imaging, lifestyle data, and so on, for tailoring the right therapeutical strategy for the right person at the right time, and to determine, and this is the part that is usually forgotten from this definition, and to determine the predisposition to disease and or to deliver timely and targeted prevention. What was very important at that time, following the innovation wheel, was that, I spoke about this definition with the main health advisor of the Romanian president, and I said, maybe it's time to engage in the topic of personalized medicine, to start building a platform, or why not a model in Romania. So in partnership with the Romanian president, we organized the first personalized medicine conference in 2016, and very, very, very fast forward this year, actually 2 weeks ago, the Romanian president promulgated the law on the right of the Romanian citizen to personalize medicine. This is the first law that states the personalized medicine as a right for each of us, the first law in the world that is completing the law on the patient's rights. Of course, We put in this the definition provided by the Council of the EU. As I mentioned, state the right to personalized medicine according to the medical recommendation. Is mandatory the informed consent. Healthcare professionals should provide citizen and patient all the information, including for the risk-benefit, and of course should be according to the GDPR legislation. I'm referring to this law because this will set, I think, a new dimension in the doctor-patient relationship that was discussed before. And on the other side, I think this law actually hopefully will create the environment in Romania for the implementation of personalized medicine in full definition of personalized medicine, including prevention. And I'll refer to this in a few minutes. Of course, personalized medicine is not something easy, and 3 years ago I have been part in the group developing the building blocks of personalized healthcare, and I put this graph not to be scared, but to highlight the second point on patient awareness and empowerment, the point number 9 on green, public health and prevention, and number 11, patient-centric care models. So in other words, without approaching the topic of our today conference, how to communicate, how to build the trust, how to engage with the citizen and with the patients, we will not be able actually to achieve the high potential of personalized medicine. Of course, it's not easy, it's complicated. And this is a picture I used to include in any of my presentations. And of course, if the audience is from people coming from the IT industry, they see here like a chip, right? Some molecular biologists see this as part of a membrane of a cancer cell, and this is actually the explanation for this. But showing this picture to an audience of patient advocates and patients with cancer, they said, you know, this is our patient journey inside the healthcare sector, healthcare systems. Some medical professionals told me, you know, our cases where we think we have this complexity and it's very tough to choose the right treatment, the right therapeutic approach for a patient. And of course, some politician and decision maker tell me, you know, this is the way we take the decisions in the healthcare sector. So the message, the key message is that it's complicated and we should find ways, and I think the session before were very informative in this regard. We should be able actually to extract from this complexity what is very useful for each person. And I'll refer to this. This is, I think, the nicest picture from last year. Is the largest rocket ever built, with the promise to one day put us on the Mars and back. Is the first fully reusable rocket. And why I actually choose the picture? To show you that actually the developments in the field of technology are the same when it comes to conquering the space, and you can see the transition from analogic to high definition when it comes to different rockets. And on the other side are the developments, 71, the National Cancer Act, then the Human Genome Project, and 4P medicine that I explained today. Of course, in the 70s, newspapers were the main source of information for the people, then were replaced by television, and now we have social media and so on. And if we discuss about communication and building trust and so on, we should take into consideration actually all these developments and all these societal transformations. Of course, cancer is the topic on very high now on the agenda. And in 2019, actually, we when Romania had the EU presidency of the Council, we put forward the idea of cancer as a priority at the EU level. The government wasn't so happy with this idea, but we continue to work on this. We had a big event in June 2019, and we published a vision paper, a new vision for cancer in the EU based on data and technology and human touch. And again, fast forward 2019, Romanian presidency of the EU Council, our event, our vision paper, and then you can see all the developments, the development of Europe's Beating Cancer Plan, the cancer mission. Then we get back at the national level and we have a law on the National Cancer Control Plan, and I'm very happy to be part of the working group. And this law is a very good one because it's actually embedded all the cancer mission recommendation and the flagships of the Beating Cancer cancer plan. So somehow to conclude, and this is the moment when the law was promulgated by our president. And the 4 documents in the left is our document, a new vision for cancer in the EU. Then is the Beating Cancer Plan, cancer mission, and the law on the National Cancer Control Plan in Romania. Of course, with Google Translate, and you have enough time, you can compare the 4 documents, and you can find a red line that actually unite them all. The main issue actually discussing with the Commission and people in 2020 and 21 was actually how to tackle inequalities, how to reduce East-West divide when it comes to cancer. And we actually identify some pillars to be considered part of the Beating Cancer Plan and mission on cancer, and the following calls. First of all, we cannot afford in our region to neglect the role of the civil society. It's clear that many public institutions failed, and I will show some data later today, failed actually to have an impact, especially when it comes to prevention, to screening, and treatment. Second, is very important actually to rethink the doctor's education. And this curricula of training should be part of best practices when it comes to cancer control. The use of data through direct citizen involvement. This, in 2020, when we put forward this document, this wasn't clear. But now if you look to the European health data space, that is saying from the beginning that each of us is the owner of his own data and is in the position and has the power to decide how, with whom, in what scope will share the data for primary use and for secondary use. I think our suggestion back 3 years ago was a really innovative one. Then I think it's important to use properly the European funding to be able to show the value for the money that will come in the region in the next years. And of course, we should leave our ego and to recognize that we should learn from other countries, from other centers that might be in the West, in the East, anywhere, that are probably more advanced, and learning then will be able to increase our value. I refer several times to the cancer mission, and you can see that the cancer mission has a foundation who is understanding cancer. There are a lot of questions about cancer that are not answered yet. Why some people, without having risk factors, develop cancer? Why some people diagnosed in early stage progress very fast, metastasize, and died early? So, another question. So there are a lot of questions around understanding cancer. The roof is to ensure the equitable access, as I mentioned, the issue of inequalities, and the 3 pillars are the prevention, prevent what is preventable. The second is optimize the diagnosis and treatment. And the third is support the quality of life, including the quality of life of the high-risk individuals, not patients, high-risk individuals for cancer. So we have been part of this conversation. We managed to set at the national level a cancer mission group trying to mirror the European Cancer Mission Board, and we organized an event last year in February when the Vice President of the Cancer Mission Board said that now it's time to move to the next level of engagement when it comes to cancer, and this next level of engagement is the engagement with the citizens. And I said, oh, it's the engagement with the citizens. And I actually, in my mind, came this graph from 2020, part of our research activities. And we tried at that time to understand what is important for the people, for the citizen. And as you can see, 41% consider that prevention and early detection of cancer should be the priority of the Beating Cancer Plan. Another 11% consider that informing the population regarding the risk factors related to cancer should be a priority. And the investment in medical research, 20%. Put all together, it's about 70+ % of the people who consider that prevention should be the focus of the European Beating Cancer Plan, together with the increased awareness of the risk factors and, of course, investment in medical research. I mentioned that for us, this message that it's time for the engagement with the citizen, and this is the next level of engagement, was like a recognition of the work we started in 2016, and I will explain you a bit about this. The question in 2016 and the question now in our country is how many people are diagnosed with cancer. Not having a national registry, nobody can specifically provide an answer, an accurate answer to that question. And we said in 2016, why not actually asking Romanians, right, citizen, have you been diagnosed with cancer? Was somebody from your family being diagnosed with cancer? And as you can see, 1 out of 5 citizens are impacted by cancer in Romania, around 5% diagnosed, and around 20% having somebody in their families diagnosed with cancer, and we did the same study in 2016, 18, and 20. So we have been able to show data about the societal impact of the cancer, and this was one of the objectives of the study. Then we asked people, are there cancer that can be detected early on? And you can see very high percentages there. But in the same time, in our country, we have one of the highest mortality in the EU, and Romania is the country where people usually are diagnosed in late stage. And of course, the same percentages to the question, are there cancer that can be prevented? Yes. So, in other words, people know that are cancer that can be prevented. People know that are cancer that can be early diagnosed, but nothing is happening. And I'll explain our approach on this. But first, I will show you other 2 or 3 images. One is regarding the sources of information about cancer. And the medical doctors were perceived like the most important source of information. And then the internet. In 2016, the television was the second source. So it's immediate, the idea to put together doctors and the internet and to build platform. And in 2017, 6 years ago, on June 1st, we launched our online platform that is driven by doctors. It's providing health innovation information on a daily basis, and I will show you a very nice slide later today. We also ask people, who do you think is the most important ally or support of a cancer patient? And you can see here the role of the relatives and the friends. Then it's the technology, and the doctors around 16%. Again, this is very important because we cannot actually isolate a cancer patient from the family, from their friends, from the societal tissue that a person is living in. And so become for us very important at that time, actually to start understanding, what this could mean for a cancer patient. Another important barrier we identify is this cancer fatalism. So we ask first, are there cancers that can be cured? And you can see that more than 70% of the people said yes. But then, does a cancer diagnosis always lead to death? You can see that roughly 50% of the people agree. So, the explanation, potential explanation, is that if the diagnosis of cancer, potential diagnosis, is closer and closer and closer to a person, this is the way a person is trying to cope with a potential diagnosis of cancer, saying that, it's coming from we don't know where, we don't have a solution for this, there are no innovation, but we know that is not the case. But this very high level of fatalism actually influences everything. And I will back to the previous slide. Imagine that these people who are relatives or friends have a very high degree of fatalism. And they have to provide an advice to a recently diagnosed cancer patient. Can you imagine this dialogue? Cancer patients asking, do you know maybe are some innovation for my cancer? And the person, the relative, who has a fatalistic approach saying, no, you will die in 3 months. You'll die in 3 months. So this will block people actually for looking for new ideas, for innovation, for new solutions and so on. And this is the case also when it comes to prevention and screening. Because if you think that cancer always leads to death, this is a major barrier also for the cancer screening. Because people might think, why should I go for, to be screened for cancer? Because if I'm diagnosed, I will be dying in about 3 months, right? So, can wait, I have no symptoms, that's fine. That's why it's very important actually to understand the individual behavior and to understand the social tissue around each individual. So, and we also measure, and this is very important, and we also measure the level of awareness on personalized medicine, on biomarkers and immunotherapies, and no surprise that compared with 2016, in 2018, actually the percentage of awareness increased. And we have been very active at that time, but we have been active also between 2018 and 2020. But people actually said that, we don't know. And the awareness actually decreased in 2020. And we tried to explain what was happening in fact. And the explanation is not a good news for the pharma industry, but it's a reality. In 2018, a lot of drugs have been reimbursed in Romania, actually starting to 2017. And of course, the strategy of the pharma industry was to put forward disease awareness campaign. And actually, the public domain, the informational space, was like an invasion of information about different diseases. So a lot of communication about cancer, different type of cancer and so on, but very few communication about the cancer innovations, about the personalized medicine and the role on cancer and so on. Of course, we continue our efforts, but wasn't enough. And for the people, it was very difficult to identify in this ocean of information. I'm not saying that is disinformation or are fake news. No, our information are correct, right? But are too many with a very low relevance. That's why, and this came in our mind at that time, that we should have a different approach. This is the proof that in 2016 we still had papers, and of course are in Romanian, but we managed actually to have the front page of the 2 papers with our study saying that 1 million Romanians are suffering from cancer. And then the COVID came, And there are some lessons. One is coming from Japan. In May 22, the right messages empower citizen. I think is a very, very clear message. Especially when it comes with the right messages on the innovations that are developing under our eyes. The characterization of the virus in 30 days using the next generation sequencing. You can imagine how many people were able actually to go to TV and to explain about this, right? Then the precision vaccinology using of the messenger RNA and so on. The concept of precision public health and so on. Was tough because actually at the beginning, and I think you all remember that the intervention were like this, like 100 years ago during the Spanish flu. Wear the mask, keep the distance, and so on and so forth. And for people, you know, they start asking what we have done for a century. If after 100 years, you as health system, healthcare professional, public health experts, decision maker in this field, you come with the same suggestions, right, as the people 100 years ago. So it's really, really tough to explain this. And I have been part in Romania, part of the communication in COVID pandemic. A very good example is coming from Taiwan, one of the countries who managed very well the crisis. And you can see the innovation in communication to the public as one of the 5 pillars that lead Taiwan to have very good outcomes during the COVID-19 pandemic. Then it was a matter of understanding, and this is just one example on how actually the telemedicine was promoted and perceived by many people as an incredible innovation, but actually telemedicine can be somehow tracked to 19th century, and the modern understanding is more than 50 years old. So what I'm trying to say is for the people staying at home, right, lockdown, watching the TV, and they see, you know, telemedicine as a solution, you know, to replace the face-to-face interaction with the doctor. Okay, then communication about sequencing the virus, wearing the mask. So a lot of information and with a very, very low relevance for many of them. And you probably remind also this. Last year was this crisis of the monkeypox infections, and the Guardian and also the WHO finally understood that communication is crucial, and now nobody actually discuss about monkeypox because the crisis was ended. And this was a matter of identifying the high-risk groups and to target them in a specific manner and being able to provide them the right message. So this is, I think, a lesson learned that already applied coming from the pandemic. At the beginning, in March 2020, everything was confused and people didn't know what to expect. And, you know, I actually expect from our National Public Health Institute to come with this graph in the left. And we wait for 1 day, 2 days, 1 week, 2 weeks, and we said, you know, we should do something to explain to the people what to expect, right? And we provide to media actually, because we put this first in the media, and then the decision maker follows these scenarios on how the pandemic could evolve in Romania in 2020, and we have 100% accuracy of our prediction back in March 2020. And on the right side, you can see, and I mentioned that we've launched 6 years ago a communication platform in Romanian. You can see that we reached 2 million unique in March 2020. This is 10% of the total population of Romania, so our platform was in top 10 websites in March 2020, because people were able actually to find on our platform useful information for them in at that moment. Of course, then I have been invited probably more than 1,000 interviews on different topics around the pandemic for 2 years, and I don't know actually what to believe now, because the anti-vaxxers did like a blacklist with people who supported, you know, the measures and the vaccination, and I'm not on the blacklist. Okay. And the pro-vax people organize different awards, gala and so on, but they don't invite me to receive, you know. So I'm in between, so probably I didn't exist or I did a very good job, I don't know. I don't know. But put all these things together, actually, the experience on cancer and the experience in the pandemic, we developed this model on personalized communication. And I will explain you this briefly. So the idea is we are actually surrounded by a micro environment, family and close friends. Then is the meso level, and this is it's important especially in small villages or small towns and so on, with community leaders like mayor, priest, educator, and so on. And this is macro environment with social and traditional media influencers. In order to have an impact, you should be able first to understand each level, each of these levels. And you can use the personal network analysis for the first layer. You can use the traditional surveys for the second, and other type of social sciences and humanities tools for the macro level. And the intervention should be tailored for each of these. Of course, the key factors are the frequency, type of message, medium channels, right moment, and so on. And what is very important as well is to assess, to implement a communication campaign, to assess again, to adapt the campaign, assess again, adapt the campaign, and so on and so forth. So this is personalized medicine and communication, in fact, that is slightly moving from one size fits all to prêt-à-porter and hopefully to haute couture. Hopefully ChatGPT will help us to develop haute couture models of healthcare communication in a day. And actually the concept is to be able to provide the right message at the right time to the right person. And we should admit that during the pandemic we failed with this, and if we discuss about cancer or cardiovascular diseases, I think the previous panels were very clear that most of the country actually failed to apply this personalized communication model. And this is not an easy task, because things are complicated, and I'm not entering into details, but the omics sciences or genomics and so on are coming, and for us it's very complicated because our human cognitive capacity is too low to comprehend all the information. That's why it's very important to extract what is important for each of us. And I refer to the omics, right? But we have something very, very close to us. The share of people who completed the initial COVID-19 vaccination protocol in April 22. And you can easily see this graph with this east-west divide. Then we move to HPV vaccination. We can see the same east-west divide, right? And these are numbers with differences between north and south, east and west when it comes to HPV vaccination. We call it last year as the Iron Curtain of vaccination, but I think it's the Iron Curtain of everything, especially when it comes to innovation. Because if you want to see a map on the access to new therapies, we will see the same divide between East and West, and so on. And my ask was, dear EU leaders, please tear down this Iron Curtain of vaccination. And this was put forward beginning of 22, part of our project Rethink Health. And this, fortunately, has happened. And this year in February, the project Rethink HPV Vaccination was launched. We are part of this consortium. And very, very important is that this consortium actually is implementing the personalized medicine metrics that I explained, developed by our group, that I explained earlier today, and will have a new approach when it comes to the vaccination. So we'll not vaccinate a girl or a boy in the 2-year frame of the project, because this is not the aim of the project. The aim of the project is to start actually with the 60%, the red part of the graph, that is usually not part of our conversation when it comes to prevention and early detection and health in general. And these are societal and behavioral factors. So for us, it's very important to understand how a person decides to vaccinate or not to vaccinate his or her daughter or boy, and so on. Usually the public health intervention like vaccination campaign are starting from this 11% area that is represent the impact of the health sector of the total determinants of health. And public health is a very small part actually of the 11%, probably it's 1%. So we expect to have 100% impact using 1% of all determinants of health. This makes no sense. So that's why our project actually is aiming to, first, as I already explained, first to measure the attitude and perception and behaviors on HPV vaccination assessment, and then to build this personalized communication and campaign and so on. And, you know, writing the application for this, we said, you know, what else we can do, because all the information about the value of HPV vaccination, all the information are already in the public domain, are in English, but also in Romanian language. So what else we can do? And the idea is actually to, based on the studies that are ongoing now, on attitude and perception and behavior, to be able to split the target group in people that are in favor of the vaccination, against of the vaccination, people that are hesitant or not interested, and then to tailor the communication campaign according to each of these categories. And especially for the hesitant and the people who are not interested, it's very important for us to understand how this attitude is built. What are the pieces of the puzzle that compose this decision? This is very, very important, and sometimes it's not something related to the vaccine itself, could be related to factors that we might not have considered as a factor that can influence this. Of course, we have some pilots in some counties in Romania, and hopefully this will be successful. Will be then able to go into the region with the project. As I told you, the idea is to build this knowledge center and to build all this synergy. I'm coming back to this slide just to raise your attention to the investments in medical research as a priority perceived by the citizens. So this is what actually citizens expect from us: to prioritize prevention, to prioritize the information on the risk factors for cancer, and to invest more money in research. In reality, reality is that actually the primary prevention of cancer is a neglected research area. And you can see that around 5% of the expenditures on cancer research in between 2010 and 2019 was on primary prevention of cancer. And you can compare with the treatment, 30%. So this model, I think, is not sustainable. The model of the health system that are actually waiting for us to become sick and then to intervene and to diagnose and to treat us, this is a model that shortly will become unsustainable. So the idea is to prevent, as the Cancer Mission Board quoted, to prevent what is preventable and to be able to diagnose as early as possible. So you can see this disconnect between what people expect and what is the reality when it comes to cancer research. And putting these things together, we proposed and was awarded this project for PCAN, Personalized Cancer Primary Prevention Research through citizen participation and digitally enabled social innovation. It's an Horizon Europe Cancer Mission project that was launched 2 weeks ago in Bucharest. We are the coordinators of this project. And the aim is actually to look through different lenses to the cancer primary prevention with a very, very strong focus on social sciences and the humanities, and with the implementation of the model of personalized communication that I've shown earlier today to you. What is very important is that our project has a very good alignment with 7 out of the 13 recommendations of the Cancer Mission, but for our today discussion, I think it's highly relevant to consider the 13, transform the cancer culture, communication, and capacity building. So you can imagine that 15 members of the Cancer Mission Board, oncologists, researchers, come together to build the Cancer Mission recommendation. And they think that is the case to transform the cancer culture and communication. To transform. So in other words, to innovate in this field, to find new ways, new approaches, considering that what has been done so far is not enough and should be reinvented, should be rethink. I think this is a very strong message coming from the heart of the community dealing with cancer on a daily basis. And we will launch actually this Sunday the first cancer primary prevention living lab in a county in the center of Romania, and we'll be able and we'll use a lot of tools coming from social sciences and humanities. We'll use models, impact models for stakeholders engagement. We'll measure not just the engagement, but the strength of the collaboration of different stakeholders and so on. So it's a 4-year project. If you invite me in the next years, I'll be able to share with you insights from the from the field. This is the third pillar of the triplet that I showed to you, the implementation phase. So we started with the science and innovation. We built the legislation, of course, with the parliament and with this engagement with the president, the legislation for cancer, the legislation for personalized medicine. We influence, I think, the European Commission to consider the inequalities and to build a model to address the inequalities. Now the Commission is very in favor of having projects coordinated from our region. And now is the implementation phase. And it's very important for us to be able to show new models and results of these activities. So, the doctor of the future will give you no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. Thomas Edison, 1903, 100 years ago, 120 years ago. So, somebody imagined 120 years ago that this should be the doctor of the future. I think we all can agree that is not the case yet in 2023. I think we should not expect the 23rd century for a prevention-based model because it's all about having the right mindset. And I think this quote of Oren Harari saying that the electrolyte did not come from the continuous improvement of candles, I think can influence us actually to have a disruptive approach when it comes to prevention of cancer, of cardiovascular diseases and so on, and to start thinking not only to diagnose and treat diseases, but to move to the health of the individuals and to make sure that people are healthy and have a good quality of life. This is actually my last slide, this is the platform Rethink Health. We launch and with the aim actually to connect as many as possible groups and people from our region and to have a common voice when it comes to the projects and initiatives, especially in this very, very important European frame that started last year and will last for 7 years. So thank you so much for the invitation. Happy to answer any questions. Oh, you already have questions? Okay. Yeah, I can.
First one.
Yeah, so the first question is, could you name one key challenge that must be overcome to allow personalized medicine to become more mainstream? Yes. So the reason why I have been asked by a senator who is a former cancer patient and is leading actually at the level of the parliament all the legislation around cancer and so on. And she asked me, what is your proposal for a new law? And I said, should be a law on the right to personalized medicine. And she asked me why. And I said, I'm invited for more than 10 years to all the medical professional annual meetings, to the patient meetings. We have the conference on personalized medicine and so on. So this bottom-up approach is not possible. That's why we need a top-down approach. So the question, the answer to the question is, if you have a professional organization that is open to this idea, this is enough to move things. If you have decision makers, this can lead to a top-down implementation. How would you describe the future of personalized medicine? A digital twin, of course, in 2 words.
And the third one, the last one.
On the slide you have shown, we can see that the trust in technology is decreasing over the years and the trust in doctors is rising. What do you think? What do you think why? It's a very good question. It's a very, very good question. And I think the technology is the one who is driving on one side, and if we refer to ChatGPT or Google and so on, who is driving both trends. One, the increasing of the trust of the individuals, because it's very easy to go on Google and to find different solutions for your questions. And this is very important, when you see a doctor, it's you and Google or ChatGPT information driven that is coming with you in front of the doctors. And unfortunately, most of the doctors failed so far to have this conversation. Okay.
That's it, I think, yeah. That's it.
Yeah.
Yeah,
Thank you so much.
Thank you. Okay.